Welcome to AHVC Heart Channel, a podcast that explores the wonder of the human heart. I'm your host, Joseph. Today, in this episode, we have Dr. Stanley Chia here with us to share about In-Stent Restenosis, and we are very excited to have you with us today. Welcome, Dr. Stanley.
Thank you very much. Hi, Joseph. Now, just to introduce myself, I'm Stanley Chia. I'm an interventional cardiologist, and I hope through this session we can just talk about some of the facts and misconceptions about in-stent restenosis.
Okay, what is In-Stent Restenosis?
First of all, let's talk about stenosis. Stenosis refers to the narrowing of a blood vessel. Cardiologists perform a procedure called angioplasty to treat blocked or narrowed coronary artery disease. And during angioplasty, we place tiny stents that are tiny wire mesh to open the blocked coronary arteries. These treatments allow blood to flow more freely through the artery. However, the treated artery may sometimes close up again, which is called restenosis. In-stent restenosis is a blockage or narrowing that comes back in the portion of the coronary artery previously treated with a stent. And in-stent restenosis is the most common form of stent failure.
So what causes in-stent restenosis?
After angioplasty and stenting, tissue grows over the stent to form a new lining for the artery wall. This lining allows blood to flow smoothly, lowering the chances of a blood clot forming within the stent. It's not uncommon for some scar tissue to form underneath this lining. But when there's too much scar tissue, the lining of the artery can get too thick and slow blood flow again. In-stent restenosis typically occurs within 3 to 6 months after treatment. Sometimes new cholesterol and calcified material may also be deposited within the stent, causing re-narrowing. And this can happen from 6 months to several years after treatment.
So what are the symptoms I should look out for?
Many people with in-stent restenosis actually don't have any symptoms at all. When symptoms do occur, they often are similar to symptoms of blocked coronary arteries. Some people experience chest discomfort or pressure called angina. These symptoms are typically brought on by physical activity or exertion that can bring on this chest discomfort. Other symptoms include shoulder or arm pain, shortness of breath, cold sweats, dizziness or feeling lightheadedness, fatigue, heart palpitation, or nausea.
I see. So how common is in-stent restenosis after a stent procedure?
Well, in the past, about 1 in 4 people who undergo angioplasty with the older generation stents, not coated with any medication that are known as bare metal stents, and they may develop in-stent restenosis. This tends to happen 3 to 6 months after a stent implantation. Restenosis is even more likely to occur, you must understand, when you don't get a stent. Now, to overcome the problem of in-stent restenosis, drug-eluting stents were developed. And this new technology combined the metallic stent platform with a polymer-releasing and anti-proliferative or anti-cancer drug, which prevents the scar tissue from forming within the stent that leads to re-narrowing. And this significantly has reduced the risk of in-stent restenosis. Currently, the estimated risk of needing repeat angioplasty due to clinical in-stent restenosis after implanting a contemporary stent or drug-eluting stent is estimated at about 1 to 2% a year.
So who are the people at risk?
Well, of course, anyone who gets angioplasty and stenting to treat coronary artery disease can, of course, develop in-stent restenosis. In particular, patients with the following factors are at higher risk. Patients who are diabetic, especially if it's poorly controlled, smokers, those with chronic kidney disease, the older population, high cholesterol levels, obesity, patients with high blood pressure, and also female patients tend to have a higher incidence of in-stent restenosis.
What are the underlying mechanisms for developing in-stent restenosis?
Firstly, patient factors, as I just mentioned above, such as advanced age, diabetes, and kidney disease. Of course, there are procedural, technical factors during the stent implantation that may influence the risk of in-stent restenosis. These include stent underexpansion, mal-exit position, and even a gap within the stent. Thirdly, there may be anatomic factors such as the vessel size, vessel tortuosity, or lesion characteristics, which the procedural risk will have to determine. And of course, lastly, the stent type. The type of stent, the platform, the thickness of the stent, the distribution of the drugs, all these can potentially lead to in-stent restenosis.
So how can we actually detect?
Firstly, in-stent restenosis doesn't always come with symptoms. So of course, it's important for all our patients to see their doctors regularly for follow-up and checkup to try to detect any problems after the angioplasty or stenting procedure. If your doctors suspect that you may have stent failure or you may have some symptoms associated with perhaps in-stent restenosis, you may be advised to undergo tests such as exercise stress tests or stress echocardiography. If you can't exercise, you can do pharmacological tests such as dobutamine stress echocardiogram or nuclear perfusion scan to try to detect ischemia. Of course, we can also look at the structure of the arteries through coronary CT scans to look at the blood vessels. And of course, finally, definitively, a patient can have a repeat coronary angiogram to look at the coronary artery disease to make sure that there's no areas of re-narrowing or new deposits that has caused a problem.
How do we actually treat in-stent restenosis?
Depending on how severe the in-stent restenosis, we can consider the following treatment options. Of course, if the patient is quite stable and the in-stent restenosis is not severe, you can just take medication. Doctors can give anti-anginal medication, introduce new medication, or increase the dose to try to overcome the symptoms that are associated with in-stent restenosis. Of course, if the in-stent restenosis is more severe and the patients are still symptomatic, then they may be advised to undergo repeat angioplasty procedure. And during the procedure, then the doctors can have a variety of options, such as using balloon angioplasty or even special balloons with blades to try to cut or slice the tissue to widen the artery. More specifically, we may want to implant a new stent in the area with in-stent restenosis or use a balloon that's coated with medication to deposit these special medicine in those areas to prevent re-narrowing. Of course, if the restenosis is more difficult to treat, there are very specialized equipment that we can use, such as rotational arterectomy to kind of drill down the material, or use laser treatment or other kind of radiation therapy to try to unblock or reduce the tissue so that the blood vessels can be wide open again. If blood can flow through, hopefully the symptoms can be resolved and the patients are well again.
Can in-stent restenosis occur more than once in the same stent?
Well, unfortunately, if it has happened once, it can happen again, because in-stent restenosis can be related to several factors that we mentioned. Patient factor, vessel tortuosity, calcification, or stent failure. The underlying mechanisms are still there. So if they're there, even after we have treated the in-stent restenosis, because the underlying substrate is not very good, so it can recur, sometimes in the same area, or perhaps even further upstream or downstream in the same stented segment. Therefore, it's very important for the doctor during the procedure to address all these underlying factors. May it be a technical issue, stent failure issue, they address all this so that the chance of a recurrence of in-stent restenosis will be minimal, so that patients will have a good, healthy, and a long-term outcome.
Dr. Stanley, how common is treatment of in-stent restenosis?
Well, we estimate that probably of all the angioplasty procedures or stenting procedures that we do, roughly about 10% of procedures will involve patients with in-stent restenosis. Of course, the relative incidence of in-stent restenosis now has been reduced significantly with our newer drug-eluting stent technology in comparison to the bare metal stent era. However, there is still a significant proportion of in-stent restenosis in the cases that we see on a daily basis.
Can lifestyle changes help prevent it?
For all patients, with or without in-stent restenosis or with underlying coronary artery disease, or those who have undergone angioplasty and stenting, we always emphasize that patients should adopt the following measures to minimize the risk of any recurrence of coronary disease. Lifestyle changes such as to reduce the sodium intake and take medication as instructed by your doctors to manage your high blood pressure. Secondly, if you have diabetes, make sure your blood sugar is well controlled. Patients should, of course, take medication to reduce their cholesterol, to reduce the risk of further deposits within the stents. Of course, we'll advise them to eat a very good, heart-healthy diet with low salt and low cholesterol so they have a good long-term outcome. If patients are overweight, we'll advise them to lose weight and also exercise regularly. Usual advice is to exercise at least 5 times a week, at least 30 minutes each time. And finally, we'll also advise them to quit smoking if they can, if they do smoke.
What is the outlook for someone with in-stent restenosis?
People who develop in-stent restenosis will, of course, be at higher risk of recurrent events. And these life-threatening conditions include what we call acute coronary syndromes, unstable angina, or heart attacks. Fortunately, we have very good means and ways to treat them. And of course, for the newer generation, drug-eluting stents have a lower risk of in-stent restenosis. Therefore, if patients are faced with these problems, we'll advise them to get treatment as soon as possible. The earlier we can tackle them, the better their long-term outcome.
What are the underlying mechanisms for developing in-stent restenosis?
So for the underlying mechanisms, these can be divided into, firstly, patient factors, as mentioned above, such as advanced age, diabetes, smoking history, and kidney disease. Then we have procedural or technical factors that influence the risk of in-stent restenosis. And these are what the doctors have to deal with during the procedure, such as stent under expansion, stent malacquisition, and stent gap. In other words, they have missed the area that needs to be covered. Thirdly, there are anatomic factors. In other words, we look at the vessel size of the patient, lesion characteristics such as the presence of a lot of hardened calcified material or blood clots, what we call thrombus load, as well as shear stress, in other words, whether there are branching factors, bifurcations. Lastly, there are stent-related factors, such as a different stent type, drug distribution, drug type, the thickness of the stent, such as whether it's a thick stent or a thin stent, as well as the stent design, and finally, the presence of stent fracture, because sometimes such stents can actually break apart.
That brings us to the end of today's episode of AHVC Heart Channel. Thank you, Dr. Chia, for sharing your invaluable insights. Remember, heart health is not just about avoiding disease. It's about living your best life full of energy and vitality. If you enjoyed today's episode, please don't forget to share it with your loved ones. Stay tuned for the next episode. Thank you, Dr. Chia.
Thank you, Joseph.